Welcome back to the Fem Health Podcast. Today, our guest is Dr. Al-Humaidhi. She is a family medicine physician and menopause expert who takes care of men and women in midlife in Seacoast, New Hampshire. Welcome to the podcast. Let's start off by talking about acne. And, when women are going through midlife transition, a lot of times they've noticed some skin changes, some of which are changes in now all of a sudden getting acne. When your whole life, you've been clear skin and now you're like, why am I getting acne like a teenager again? So why does this happen?
So this is a really common question and a reason that women come and see me all the time. And they're like, I'm in puberty again. This is terrible. What's happening to my skin? And the reason for it is there are multiple reasons, but the main reason is this loss of balance between our hormones. And as we lose estrogen in perimenopause and menopause, even though our testosterone is also kind of falling over time, but the effect of the testosterone on our skin is sort of augmented because of the loss of estrogen. Mm-hmm. So we start to get that acne, and also similarly the reason we get the menopausal chin hairs that a lot of people talk about.
I know those chin hairs are so annoying, right? But it's interesting because, it's people, we know that we are also declining in testosterone, but it's really the relative ratio, right, of the estrogen to testosterone. That's why we're seeing those things.
Absolutely. And that's something that I think a lot of women don't quite understand. They feel like this, oh yeah, just, give me the HRT and I'll be on my way. But, doing HRT for women involves a lot of tinkering, making sure, because, you're going to be different to the next person and the next person, and no two individuals are the same. And it takes a while to find the sweet spot and what's perfect and the perfect balance of all of your hormones for you to feel really optimized.
Yeah, absolutely. I completely agree. And I think it's so individual, especially during perimenopause, where it's like this roller coaster where the symptoms are going up and down and all over the place. And your estrogen levels are going up and down like a literal roller coaster. And sometimes it's not just giving all the different hormones. It's starting with one and sort of layering them on. What are some other things people can do to help treat their acne or other skin changes?
So it's important to note two other things. The first one is that during perimenopause and menopause, we start to lose a lot of collagen and elastin in our skin. It's the same thing that's happening in our bones. So as you lose collagen and elastin, you lose a lot of volume in your face, and people feel like they suddenly have kind of sunken look around their eyes, around their mouth, and they're frustrated. They're not unhappy about it, I suppose. So the things we could do about that is optimizing your nutrition, right? Making sure that you're getting enough protein, making sure that you're hydrated. There are a lot of aesthetic procedures that you could look at, but really the importance with that is that it really starts from within, and your skin is a reflection of your inside health. So you have to optimize, you can spend thousands of dollars and multiple tens of thousands of dollars on every aesthetic treatment and not look healthy and well, because that health of your skin starts from within. You have to be well inside. You have to eat well and exercise and sleep and manage your stress and, manage your hormones if that's an issue for you. And that will, pay dividends basically on your face and on the rest of your body and your bones. But a lot of people also talk to me about, gut health. Gut health is really important. Your gut health is reflected in your skin. And that's a really important one for acne. And, in puberty, a lot of acne is treated with antibiotics and women are given antibiotics, and that's not wrong. But antibiotics are probably going to make our gut health worse. And so we're kind of getting into this cycle and vicious cycle where we're kind of just a vicious cycle towards acne. And now we're stuck on the antibiotics. So it's really important to think about, what is the health of our gut? Are we eating a diverse diet? Are we getting those probiotics? Are we getting enough fiber? Because it literally shows on our face.
Absolutely. I can't agree enough. And I think that you talked about like stress, right? And I think we're like always like, yeah, eat right diet. But stress is so important during this transition because this is a time of high stress, right? Your kids are aging, your parents are aging, you're getting busier at work potentially, and everything is like at its peak, including your stress. And so if you're not managing that, like that does have an effect on acne.
Absolutely. And we have, this is one reason people think I'm insane when I started my business, that I have somebody that does stress management. I have a mind-body therapist that does meditation and mindfulness in my practice.
That's amazing.
And the reason for that is because, and I talk to women and men about this all the time, is that if you don't manage your stress, you're not going to sleep. right? Your hormones are not going to be optimized. Your skin is not going to look the way that you want it. You're not going to lose the weight that you want to lose. All of these things are connected. I describe it as the spokes of, your body is a wheel, and all of these things are the spokes of a wheel. There's a reason that I didn't call, my practice Hormones by Noor or diet, weight loss medication by Noor. I called it Lifestyles by Noor because you have to, weight loss medication or hormone is one spoke of the wheel. We have to address everything if we're really going to talk about your overall health. And stress is a huge part of that.
Absolutely. In terms of other things for gut health, do you have any recommendations for things that people should do to optimize their gut health? I know you mentioned fiber and prebiotics. What is sort of your approach to that?
So fiber. The majority of people that come and see me are not eating enough fiber.
Well, I think in the U.S., most people are not getting enough fiber.
And even people that come and see me that are trying to, right? They're already, by the time they get to me, they've tried, they're trying to optimize their health. Even they're not eating enough fiber. So fiber, I draw pictures in my office, to try to explain that we have this healthy gut bacteria that is crucial to our health. It's important for our immune system. It's important for nutritional deficiencies. It's important for our overall health. And if you don't feed it, and it only eats fiber. And if we don't feed it fiber, it starts to eat us. And that's how we end up with all, various health issues, whether it's autoimmune conditions, whether it's, inflammatory conditions. And if we don't address our gut microbiome, then we're sort of missing a huge portion of our overall health. So fiber is a big one. I am not a big, take probiotics. There's not a lot of evidence really that they work. What there is evidence for is diversification of your diet, right? Yeah. So, this idea, you might have heard, eat the colors of the rainbow. I use that all the time with my clients. I want you to eat the colors of the rainbow. When you go to the grocery store, once a month, I want you to buy something you've never bought before in the produce aisle. Most of us are eating the same 5 vegetables. We're eating the same 5 fruit. Every time we go to the produce aisle, we buy the same things. So, doing it once a week, I think is too much and overwhelming. But once a month, try to buy a different form of produce that you've never used before. Google it, look at it on TikTok, whatever, how to make it. Because that's how we diversify our gut microbiome. And things like that are, that have active bacteria. So things that like active dairy, kefir, apple cider vinegar is a great one.
Yeah.
Kimchi, right? Apple cider vinegar. And I'm not talking about apple cider vinegar gummies and all these things. Just
or the TV show.
Buy the bottle. Buy the bottle that has the mother in it and take a spoonful and you're good.
Yeah.
It shouldn't be expensive.
That's awesome. The other thing that happens during menopause is women tend to start getting joint pain. So why are we seeing this rise in joint pain during this time?
So what we need to understand about estrogen and testosterone, but estrogen, if talking about the context of women, is that estrogen is an anti-inflammatory hormone. So I explain it to my patients. It's kind of like a blanket. That's, you've had this blanket around your immune system. It's like you've been taking ibuprofen 3 times a day for the last 30 years, and now you're not. So that kind of pushes us into an inflammatory state. And that manifests in our bones. So we have inflammatory changes that happen in our bones, and that manifests as joint pain. Equally, because of this loss of this sort of immune blanket, that's when a lot of women present with their autoimmune conditions. So their rheumatoid arthritis, their polymyalgia rheumatica, their lupus, their psoriatic arthritis, and all of those present with joint pain. So if you're having joint pain in this time, I would recommend that you get a bit of a workup, make sure that it's not an autoimmune condition that needs to be addressed. But in many circumstances, it's to do with our hormones and the changes that are happening.
Yeah. And there's like estrogen receptors in our joints. And, those are so important for obviously bone health. Estrogen is preventative for having bone loss, and also helps with joint pain. And so we see this rise in frozen shoulder in menopause.
Yeah.
And for years, I think people didn't even know that was a thing.
I agree. And injury, right? Because you've got we have these receptors on all of our joints, but we talked about skin and the loss of collagen collagen in our skin. Well, that's also happening in our joints and our bones, right? We're losing, the volume. It's kind of like our tendons and ligaments. They're losing volume with this loss of collagen. So they are more susceptible to injury. And women have a tendency, they're like, well, I've been running for 30 years and all of a sudden I've had an injury, or I've been doing CrossFit or whatever you've been doing. And all of a sudden I've picked up 3 injuries. And that's because we become more susceptible with this inflammatory change.
So what can women do to help optimize their joint health during this time?
So keep moving is a big one. They talk about movement of lubrication. So keep moving. See a physical therapist. Physical therapists are amazing people that can really help you. They can help you move well and move without injury. From a point of view of your diet and your lifestyle, really thinking about living an anti-inflammatory life. And that's things, avoiding processed foods and added sugars, and also avoiding alcohol. Alcohol is very pro-inflammatory, unfortunately, even though that's not a very popular thing to say. It never goes over very well. But, alcohol really has no place in an anti-inflammatory life, unfortunately.
Yeah.
So I'd say those things.
Well, I'd say for alcohol, there's no benefit in terms of cancer prevention. And a lot of women get hot flashes at night after they drink their alcohol.
When you talk about alcohol, people really get in their feelings.
I know.
And it's a cultural thing, and people use it, which is fine. But I think for a long time, it's funny, in medical school and in training, it's like, you don't smoke. That's a no. It's just a straight no. And I don't have any problem saying that to you. But the alcohol thing, we were kind of drilled, well, don't say no, say moderation, and I think as I've sort of grown and in confidence, I've found my voice about it. I'm like, no, if it's up to you and your choice if you choose to drink alcohol, but it really has no place in a healthy lifestyle.
Yeah, I agree with you. Why do women in menopause start noticing their bellies become more bloated and they start having trouble with keeping off the weight?
So I think I talk to women about 3 major things that happen that cause us to gain weight or to see a shift in our body composition. The first one is, as we lose estrogen, we become a little bit insulin resistant, right? So we need more insulin released by our pancreas in response to the same dose of glucose, like an apple, for example. So 10 years ago, you needed a certain amount of insulin to manage that dose, and now you need significantly more. The reason that that's a problem is because the higher your insulin level circulating, the more visceral fat you will deposit, and that you see this change in body composition. And it's really amazing. I do body compositions on every patient, and I can tell what their metabolic parameters are going to be based on their body composition, or the opposite. It's just the 2 things are so in bed with each other. The second one is that we start to lose muscle mass, right? So without the support of our estrogen and testosterone, we often see a loss of muscle mass over time. And I explain to people, our muscles are it's like our engine. And with the less muscle we have, the less overall calories we will burn in a 24-hour period. And so you can go from being, having a resting metabolic rate, let's say, of 1560 calories, maybe 10 years ago. And now actually it's 1300, and you barely noticed it with in terms of your weight, but your body composition changed. And you're telling me, I'm just eating the same thing. I don't understand. Well, actually, because of the loss of muscle, you're now in a surplus in terms of your calorie intake.
Yeah.
And then the third one is that if you don't feel well, if you don't sleep, if you feel terrible and you're exhausted and fatigued and, stressed and you're getting no sleep, you're less likely to exercise. You're not going to make the best decisions for yourself. So it's kind of this vicious cycle of 3 things that are involved in this weight gain that women see.
Yeah. And you have to fix all 3, right? Because I think what happens is people think, oh, I'm going to go on hormone replacement and everything's going to get better. But if you don't address the other issues in your life, it's not.
Exactly.
You got to do all the hard work.
Yes. And I think people people are afraid of hard work. When you start to talk about, doing the stress management and doing the meditation and seeing the dietitian and lifting the weights, it feels overwhelming, but it's really important that people understand that it's not about, actually, I don't really care about your weight. Mm-hmm. I know that you're worried about how you look in your weight. I'm worried about your muscle mass. What I'm worried about is if you can walk in 15 years. That's my goal for you. And while I get you to that goal, we're going to get you the body that you want. But for me, that's what my focus is, not on your weight right now.
So what about sore breasts? So women start noticing that they like all of a sudden their breasts are more tender. They haven't felt like this in years, and they're noticing these changes. Why is this happening?
So like you mentioned, in perimenopause, it's this roller coaster of hormones. I describe it, trying to treat perimenopause in a lot of women. It's kind of like pin the tail on a donkey. You just don't know what you're doing anytime. You're just you're chasing it all the time, which is fine, which is why, my clients, everybody needs to stay in touch with each other, and it needs to be a very high touch level of care because you need that level of care at that time. But this up and down. So you've got estrogen that's high, progesterone that's low, and then estrogen that's low. And as those fluctuations start to happen, your breast tissue, which is responsive to hormones, will respond. So women often notice, like when they start HRT, that their breasts are a little bit bigger or they're a little bit sore. That usually settles, but that's because your breast tissue is responding to the hormones that we're giving you. And the same thing happens to the hormones that you produce endogenously, like during your pregnancy or right before your period. You might have noticed that you've had some, sore breasts, and that it's the same situation, just in a different time frame. And getting your hormones optimized are a good form of doing that, making sure you're hydrated, avoiding alcohol. Mastalgia is very associated with alcohol intake. And then eating primrose oil for some people is really helpful. It really works for mastalgia, and vitamin E as well. Supplementation can be really helpful.
That's great. I didn't know about primrose oil. That's very interesting. When we're talking about women going on hormone replacement therapy, how long do they need to be on hormone replacement therapy?
It's $1 million question, isn't it? So you can be on hormone therapy for the rest of your life if you choose to. You will reap the benefit from hormone therapy for as long as you take it. When you stop hormone therapy, you will lose the benefit, right? You'll lose the benefit on your metabolic health. You'll lose the benefit on your bone health. You'll lose the benefit on your sleep, your stress management, et cetera. So you can take so I tell people, as long as you don't develop a contraindication, you can take hormone therapy for the rest of your life. But people get all up in arms and they keep tripping over this idea of the 10-year window. And that came from the WHI, this idea of the 10-year window, that if you initiate hormone therapy within 10 years of menopause, you can prevent cardiac disease, right, by about 30%. But if you initiate hormone therapy after 10 years, you probably don't have that same benefit. So this is where the 10-year window is. But people, make this a very staunch thing, and they say, well, you can't start hormone therapy after 10 years. Well, actually, you can start hormone therapy after 10 years with an appropriate conversation about risk. Or they say, then you have to stop hormone therapy after 10 years. No, we're talking about people starting hormone therapy after 10 years. So people get really confused about what that means. So all that means is that you will derive the best cardiac benefit from hormone therapy if initiated within 10 years. If you started after 10 years, you might not get the same cardiac benefit, but you certainly will get the benefit on your mental health, on your bones, on your metabolic parameters. There's still many benefits to be had after that 10-year window.
Yeah, with an appropriate risk assessment. I think you have to assess your cardiovascular risk. The concern is that, to my understanding, is that when you give hormones after the 10-year window, if there's already some plaque buildup, you can destabilize that plaque. And so if you are already at high risk for cardiovascular disease, then you have to have a discussion about that. But you can still get benefits from it.
And there's ways we can assess that, right? So we have cardiovascular risk parameters. We can do CT calcium scores. We can do CT angiography if we wanted to. We can refer to cardiology if we feel somebody is super high risk for an assessment. There are many things that we could do to assess a person's cardiac risk. And also in that conversation, we need to be doing what we can to manage those risk factors, right? Is this patient taking aspirin if they're at such high risk? Are they on a statin? Is their blood pressure optimized? What are they eating? Are they sleeping? There are all these other things that we can address aside from their hormones that's going to lengthen their life while we figure out the hormones.
Yeah. Well, thank you so much. Where can people find you?
So I'm online. So my website is www.lifestylesbynoor.com, and I'm on Instagram, Lifestyles by Noor. My practice is in New Hampshire. I also see patients in Maine. I'm working on Vermont. So yeah, would love to see you.
Awesome. Thank you.
Thank you.